3.
Okay, I'm gonna apply the drops of water to my blood typing slide or card, so that's ready. My Eldon card sticks are in place. Disinfect the fingertip using an alcohol prep. Make sure your one hand is gloved. After disinfecting, just kind of wave your hand so that it dries. Remember, the lancet is spring-loaded, single-time use. Get a good drop of blood started. Grab the hematocrit tube using capillary action. You want to get about half of the tube full of blood. If you can't get half, at least a third is fine. You're going to press gently into the clay and lay it to the side. I still have a large drop of blood available for the coagulation tube. This is the one that's a little bit larger. You don't want any air bubbles if you can help it, because when we're ready to do this test in 2 to 8 minutes, which is the length of coagulation time for most people, we're going to break the tube to view fibrin threads. Okay, and that is plenty. Then I'm going to move to the Eldon stick. I'm going to put 1 drop, lay it up against the anti-A, another drop, lay it up against the anti-B, another drop, up against the anti-D, and then finally my control, which should be negative. Then I have more than enough to blot the Tallquist paper, and within 15 seconds, I'm going to compare the color, which I think I'm at 14.1. Check all the colors just to make sure. You want to match it most closely, and I believe 14.1 is my number. So that test is instant. So I'm still bleeding, and I'm just going to use pressure. I'm going to push my finger into this double layered paper towel to get it to stop bleeding while I mix my Eldon stick, use my Eldon sticks rather, to mix my blood sample with those antibodies that were the little colorful circles. Do not mix the samples together. Stay within the circle. This is where you don't want to be creative. You want to stay in the circle. And the anti-D, which is also the Rh antigen, sometimes takes a little longer than the A or the B. The control should be a negative control, so you shouldn't see anything happening in there. And what you're going to need to do is take the card and just kind of go back and forth. And this worked out really well. I can see agglutination in the anti-A. That means I have the A antigen. There is nothing going on in the anti-B well, so I do not have the B antigen. You can see the little speckles of agglutination in the anti-D, so I do have the Rh antigen. Nothing happened in the control, which is what we expect. So my blood type is A positive. Beautiful. So here we've waited a little bit longer, and if you go back and forth, you can see agglutination in the A and the D circles, and agglutination is an antigen-antibody reaction. So there were antibodies in those colored circles that reacted with the antigens on my red blood cells in the A well. what we're going to do with this hematocrit tube, which we've left sitting here for several minutes, and that's okay because there's heparin in this tube preventing coagulation. We're going to want to separate the formed elements from the plasma, and so I'm going to go put this in the special hematocrit centrifuge. Okay, so we have a couple of tubes in here. There's one that doesn't have anything in it, just for balance. You want to either hand this to your instructor, or your instructor will tell you to put it in properly. So that seal ease, that little clay at the end there, that's what stops the sample from coming out. Since we're in a centrifuge here, we want the seal ease to be on the outside because this is going to spin. All the heavy stuff is going to go to the outside. The plasma will be towards the center because it's less dense. And we will separate out all of those cells from the mostly water of the plasma. Okay. Okay, this is the most difficult test to view the fibrin threads. Sometimes it works and sometimes it doesn't. So actually, I'm not going to do mine yet because I can see my blood moving inside this coagulation tube. So I'm going to wait just a little bit longer, but when I'm ready to do it, I'm going to put the tube between my index finger and thumbs, both of them, and I'm going to start at one end and I'm going to break it slowly and pull the ends apart. It's a lot harder than it sounds. You don't want to break it and then pull way apart because, you know, you won't see the threads. So you got to keep the edges close to each other when you do this. And often we miss, or there's an air bubble, you don't break it in the right place. So it's a really hard thing to do, but when we get really excited when we can see the fibrin threads though. So, okay, I've already tried to break this one time and I didn't get good results. So we'll try again, kind of in the center here. I keep the broken edges together. Yeah, it's a bust.